Have you ever heard the term leukemia and wondered what it truly means, or perhaps felt overwhelmed by the different types mentioned? Understanding a diagnosis begins with clear information. Leukemia is not just one illness, but a group of cancers that start in the blood-forming tissues, usually the bone marrow. These cancers are broadly classified into four main types: acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. Each one behaves differently, which is why understanding these classifications is so important for patient care. The primary distinctions among these types come down to two key factors: how quickly the disease progresses and the specific type of blood cell that is affected. Leukemia is considered acute when the abnormal blood cells, called blast cells, multiply very rapidly, leading to a swift onset of symptoms. In contrast, chronic leukemia involves more mature blood cells that grow slowly over time. This often means symptoms may be mild or even absent for an extended period. The other major distinction is whether the cancer affects myeloid cells, which develop into red blood cells, platelets, and most white blood cells, or lymphoid cells, which are a specific type of white blood cell called lymphocytes. For example, acute myeloid leukemia, or a ML, and chronic myeloid leukemia, or CML, both affect myeloid cells. However, a ML progresses quickly due to immature blast cells, while CML develops slowly from more mature cells. Similarly, acute lymphocytic leukemia, or a LL, and chronic lymphocytic leukemia, or CLL, both involve lymphoid cells. A LL is fast-growing with immature cells, while CLL is slow-growing with mature lymphocytes. These clear categories help doctors pinpoint the exact nature of the cancer. Understanding these classifications is crucial because it directly influences the treatment plan and what you can expect regarding the disease progression. Knowing whether it is an acute or chronic type helps predict how urgently treatment is needed. Knowing if it is myeloid or lymphoid points to the specific cell lineage that is cancerous, which guides the choice of therapies, including chemotherapy, targeted drugs, or even stem cell transplantation. This knowledge empowers you to have more informed conversations with your medical team. Doctors diagnose these specific types through a combination of blood tests, bone marrow biopsies, and advanced genetic testing. These tests look for the specific genetic changes or markers on the cancer cells to confirm the diagnosis and classify it precisely. For instance, the presence of the Philadelphia chromosome is a defining characteristic of chronic myeloid leukemia. This detailed analysis is vital for tailoring the most effective approach for each individual. Ultimately, grasping the differences between acute and chronic, and myeloid and lymphoid leukemia allows you to better comprehend your diagnosis and potential treatment paths. It provides a clearer picture of what to anticipate and how best to support yourself or a loved one through the journey, turning complex medical terms into understandable steps toward better health management.